December 15, 1944. The waters off Leyte, Philippines. The medical transport ship Hakone Maru listed 30 degrees to starboard as USS Fletcher closed to within 800 yards, her 5-inch guns trained on the Japanese vessel's bridge. The morning sun reflected off the destroyer's hull, creating a blinding glare that forced the 47 passengers aboard the transport to shield their eyes as they watched their fate approach. Among those passengers were 23 Japanese military nurses and female auxiliaries fleeing the collapsing defense of the Philippines. They represented the last organized group of Japanese military medical personnel escaping the American advance that had trapped General Yamashita's forces in the northern mountains of Luzon. These women had served in field hospitals, aid stations, and evacuation centers throughout the Pacific Campaign. They had witnessed the gradual deterioration of Japanese medical capabilities as supply lines stretched thin and resources dwindled. Nurse Lieutenant Michiko Tanaka, 24, pressed her back against the ship's superstructure as the American destroyer's loudspeaker crackled to life in accented Japanese. The voice was clear, professional, oddly courteous for what she expected to be her final moments. "This is the United States Navy. Prepare to be boarded. Surrender all weapons and assemble on deck with your hands visible. You will not be harmed if you comply." Tanaka clutched her leather medical bag, the one her father had given her when she graduated from the Tokyo Women's Medical College in 1941. Inside were surgical instruments, morphine ampoules, and bandages that had become more precious than gold as the war progressed. She had used these tools to save lives in the fetid jungles of New Guinea, the coral caves of Palau, and the bombed-out hospitals of Manila. Now she wondered if she would live to use them again. The indoctrination she had received before deployment echoed in her mind. Americans were WWII, the Anglo-American devils who raped and tortured prisoners before executing them. The imperial military had shown them photographs, testimonies, evidence of American brutality toward captured Japanese personnel. Death before dishonor was not just a slogan, but a practical necessity to avoid unspeakable suffering. Yet as the American boarding party approached, weapons lowered, something didn't match the propaganda. The sailors moved with discipline rather than bloodlust. Their leader, a pharmacist's mate first class whose name tape read Sean, approached the group of women with his hands clearly visible and empty. His face, Asian features that marked him as likely Japanese-American, showed no hatred or contempt. "I am pharmacist's mate Sean," he said in fluent Japanese, his accent carrying traces of Hawaiian pidgin. "You are now prisoners of the United States Navy. You will be treated according to the Geneva Convention. Medical personnel will receive special consideration under international law." The women exchanged glances of confusion and fear. Geneva Convention was a term they had heard but never understood in practical terms. Japanese military doctrine recognized only victory or death, with no provisions for the treatment of prisoners because surrender was considered impossible for true soldiers of the emperor. They had been taught that international law was a Western weakness that Japan's enemies used to constrain superior Japanese fighting spirit. Auxiliary nurse Keiko Yamamoto, 22, stepped forward slightly, her training overcoming her fear. She had served 18 months in field hospitals and had seen American medical supplies captured from downed aircraft and overrun positions. The quality and quantity had always puzzled her. Why would a decadent, weak nation invest so heavily in medical equipment for its soldiers? "What will happen to us?" she asked in broken English, the language she had studied before the war when cultural exchange was still possible. Chin smiled, an expression that seemed genuine rather than mocking. "You will be taken to a hospital ship for medical evaluation and treatment. Then to a prisoner facility where you will be housed according to your rank and status as medical personnel. You will be allowed to write letters home. You will receive adequate food, medical care, and quarters appropriate to your position." The words sounded impossible. Tanaka had been told that American prisoners were worked to death in mines, starved systematically, used for medical experiments. The idea that enemy medical personnel would receive special treatment seemed like an elaborate deception designed to extract information before the real torture began. As the boarding party secured the transport ship, American sailors began treating the Japanese crew and passengers with a courtesy that defied every expectation. Water was offered to those who appeared dehydrated. A Navy corpsman examined an elderly Japanese merchant marine officer who had suffered a minor injury during the ship's desperate evasive maneuvers. The treatment was professional, competent, entirely without the sadistic pleasure that propaganda had promised. The transfer to USS Sanctuary took place under gray December skies that threatened rain. The American hospital ship rode low in the water, her white hull and red crosses marking her as a non-combatant vessel under international law. As the Japanese women climbed aboard, they entered a floating medical facility that challenged every assumption about American military priorities. The ship had been converted from the luxury liner SS America, requisitioned by the Navy, and transformed into a 750-bed hospital complete with 12 operating rooms, radiology facilities, a dental clinic, pathology laboratory, and pharmacy. The conversion had cost $8 million and required the installation of 3,000 tons of medical equipment. Every surface gleamed with fresh paint and antiseptic cleanliness that contrasted sharply with the field hospitals these women had served in. Nurse Tanaka's first glimpse of the ship's interior stopped her completely. Electric lights burned continuously throughout the vessel, not the dim emergency lighting she had grown accustomed to in Japanese facilities where electricity was rationed for critical operations only. The corridors were wide enough for stretchers to pass each other, lined with supply cabinets stocked with medical equipment she recognized from pre-war textbooks but had never seen in such quantities. The American medical staff moved through these spaces with casual efficiency that spoke of unlimited resources. Nurses in crisp, white uniforms carried supplies without the careful hoarding behavior that marked Japanese military medicine. Doctors consulted X-ray films illuminated on viewing boxes that remained lit for convenience rather than being switched off immediately to conserve power. Hospital corpsman Second Class James Morrison, assigned as escort for the Japanese prisoners, noticed their stunned silence as they were led to temporary quarters. Morrison had served aboard Sanctuary for 8 months, participating in amphibious landings at Saipan, Guam, and Leyte. He had seen American casualties arrive in overwhelming numbers, watched the ship's medical staff work around the clock to save lives. What seemed routine to him appeared miraculous to women who had practiced medicine under conditions of extreme scarcity. "The doc will see you in about an hour," Morrison explained through pharmacist Chin's translation. "Just routine medical screening. Standard procedure for all prisoners." He paused, noticing their obvious fear. "Nobody's going to hurt you. The old man runs a tight ship, but fair. Medical personnel get treated right around here." The temporary quarters assigned to the Japanese women occupied a converted stateroom that had once housed civilian passengers. 23 bunks with clean mattresses and fresh linens. Individual lockers for personal possessions. A shared head with running water, flush toilets, and electric lighting. After months of living in dugouts, caves, and bombed buildings, the accommodation seemed luxurious beyond imagination. Auxiliary nurse Sachiko Ito, 26, turned on a water tap and watched clean water flow freely. In the Philippines, clean water had become so scarce that surgical instruments were often sterilized with captured sake or medicinal alcohol. The idea that prisoners would have unlimited access to clean water for bathing seemed like another incomprehensible luxury. As evening approached, the women were called to the ship's mess for their first meal in American custody. They had expected rice gruel, perhaps supplemented with fish if they were fortunate. Instead, they encountered a meal that exceeded what many had eaten as civilians before the war. Beef stew with actual pieces of meat, fresh bread with butter, vegetables that had been properly preserved, milk that wasn't powdered or condensed. The portions were generous enough that finishing everything seemed impossible after months of subsistence rations. Nurse Yamamoto stared at her plate, overwhelmed by abundance that contradicted everything she had been taught about American weakness and resource constraints. "They feed prisoners better than we fed our own wounded soldiers," she whispered to Tanaka in Japanese, unaware that several American personnel understood the language. The ship's executive officer, Commander Robert Hayes, had anticipated this reaction. Hayes had served in the Pacific since Pearl Harbor, rising through the ranks of the Navy Medical Corps. He had seen Japanese prisoners before, witnessed their amazement at American logistics and medical capabilities. What never ceased to surprise him was their genuine shock at receiving humane treatment. "They've been told we're monsters," Hayes explained to the ship's senior medical staff during evening briefing. From their perspective, being treated like human beings is the last thing they expected. Some of them are going to have psychological breakdowns just from the cognitive dissonance. We need to be prepared for that. Dr. Lieutenant Commander Sarah Mitchell, the ship's senior female physician, had already begun forming her assessment of the Japanese medical personnel. Mitchell was one of only 47 female doctors commissioned in the U.S. Navy during the war, a pioneering figure in military medicine who had overcome significant institutional resistance to serve in combat zones. Her presence aboard Sanctuary represented American pragmatism in utilizing all available medical talent regardless of gender. Their training appears solid, Mitchell observed, reviewing the preliminary interviews conducted through interpreters. Classical European medical education adapted for tropical conditions, but their understanding of military medicine is completely different from ours. They seem to expect medical personnel to be expendable, to die with their patients rather than preserve medical capability for future casualties. This observation would prove central to understanding the psychological transformation these women would undergo. Japanese military medicine operated under the assumption that medical personnel shared the same obligation to fight to the death as combat soldiers. The concept of medical neutrality, of preserving healing capability for all sides, was foreign to their training and experience. As night fell over the Pacific, the Japanese women lay in bunks with real mattresses, listening to the hum of electric generators that kept the ship's systems running continuously. Through the portholes, they could see lights burning throughout the American task force, destroyers and cruisers maintaining full illumination without concern for enemy detection. This casual display of energy abundance would prove to be their first lesson in understanding American industrial capacity. Tanaka wrote in her hidden diary before sleeping, using pencil stub and paper torn from a medical form. The Americans waste more electricity in one night than our entire hospital used in a month. They treat prisoners like guests. Something is very wrong with what we were told about these people. The transformation had begun, though none of them realized it yet. Within weeks, these women would witness medical capabilities that would fundamentally challenge their understanding of warfare, humanity, and the nature of the conflict they had been fighting. They had expected to die as martyrs for the emperor. Instead, they would live to become witnesses to a different kind of power entirely. December 18, 1944. USS Sanctuary, hospital ship. The morning brought the first systematic medical examinations that would introduce the Japanese women to American military medicine's scope and philosophy. What they encountered challenged not only their expectations of captivity, but their fundamental understanding of how medical resources should be allocated in wartime. Dr. Lieutenant Commander Sarah Mitchell began her examination of Nurse Lieutenant Michiko Tanaka at 0800 hours. The examination room contained equipment that Tanaka recognized from medical school but had never seen deployed in such quantities for routine use. An X-ray machine dedicated solely to prisoner screening. Laboratory facilities capable of conducting blood work within hours rather than days. Pharmaceutical supplies that included medications she had only read about in captured medical journals. "I'm going to conduct a complete physical examination," Dr. Mitchell explained through pharmacist Chin's translation. "This is standard procedure for all prisoners, not special treatment. We need to identify any medical conditions that require immediate attention." Tanaka submitted to the examination with growing amazement. In Japanese military medicine, complete physical examinations were reserved for officers or critical personnel. Most soldiers received cursory health checks focused on immediate combat readiness. The thoroughness of Mitchell's examination, including blood pressure measurements, heart auscultation, and reflexology testing, represented a level of medical attention that exceeded what many Japanese civilians received in peacetime. The laboratory results, available within 6 hours, revealed chronic malnutrition, iron deficiency anemia, and vitamin deficiencies consistent with prolonged military service in the Pacific Theater. These conditions were endemic among Japanese forces by late 1944, accepted as inevitable consequences of extended combat operations. Dr. Mitchell's response challenged this acceptance completely. "We're going to start you on iron supplements immediately," Mitchell explained, showing Tanaka bottles of ferrous sulfate tablets. "Your hemoglobin count is dangerously low. We'll also adjust your diet to include additional protein and vitamins. I want to see improvement in your blood work within 2 weeks. The casual dispensing of expensive medications to an enemy prisoner seemed impossible to Tanaka's understanding of wartime medicine. Iron supplements were precious in the Japanese military, reserved for critical cases where combat effectiveness was directly threatened. The idea that they would be provided to restore general health rather than immediate military utility represented a completely different philosophy of medical care. Auxiliary nurse Keiko Yamamoto's examination revealed more serious conditions. Chronic dysentery, weight loss consistent with prolonged malnutrition, and symptoms suggesting the early stages of beriberi, a vitamin B1 deficiency common among rice-dependent populations with limited dietary variety. Dr. Mitchell's colleague, Lieutenant Dr. Robert Chun, took charge of Yamamoto's case with an intensity that puzzled the Japanese observers. "This is serious malnutrition," Dr. Chun explained to his medical staff within hearing of the interpreters. Classic presentation of multiple nutritional deficiencies. We need to start refeeding slowly to avoid refeeding syndrome. High-calorie, high-protein diet with thiamine supplementation. Monitor cardiac function during nutritional rehabilitation. The medical terminology was familiar to the Japanese nurses, but the context was revolutionary. Dr. Chun was treating Yamamoto's malnutrition as a serious medical condition, requiring sophisticated intervention rather than an inevitable consequence of wartime service to be endured until death or victory. The allocation of advanced medical resources to restore health rather than simply maintain combat effectiveness represented a fundamental difference in medical philosophy. Yamamoto's treatment plan included regular meals supplemented with protein powders, vitamin injections, and careful monitoring of her body's response to increased nutrition. Within days, American medical personnel were investing more resources in her recovery than Japanese military medicine had invested in entire field hospitals. The psychological impact of this disparity would prove profound. The most dramatic moment came on December 20th when Yamamoto complained of severe abdominal pain during routine examination. Dr. Mitchell's assessment, confirmed by X-ray and blood work, indicated acute appendicitis requiring immediate surgical intervention. In Japanese military medicine, such cases were often managed conservatively due to limited surgical resources and the assumption that medical personnel should not receive priority treatment over combat soldiers. "We need to operate immediately," Dr. Mitchell explained to the group of Japanese women who had been allowed to visit their colleague. The infection could spread to her abdomen and become fatal within hours. This is a routine surgical procedure aboard this ship. The concept of routine surgery for prisoners seemed impossible to the Japanese observers. They had served in medical facilities where appendectomies were considered complex procedures requiring specialized equipment and extensive resources. The casual confidence with which American medical staff approached the surgery suggested capabilities far beyond what they had experienced in Japanese military medicine. The surgical suite where Yamamoto's operation took place represented American medical technology at its most advanced. General anesthesia using gas machines that provided precise control over patient consciousness. Surgical instruments made from stainless steel rather than the carbon steel implements common in Japanese military hospitals. Electric surgical lighting that illuminated the operative field without shadows or heat. Suction equipment that kept the surgical site clear of blood and fluids. Dr. Mitchell performed the appendectomy with 2 surgical nurses assisting, using techniques that Tanaka recognized from medical school but had never seen executed with such precision and resources. The surgery required 45 minutes, conducted under full sterile conditions with post-operative pain management using morphine derivatives that were precious commodities in Japanese military medicine. The surgery was successful, Dr. Mitchell reported to the waiting Japanese women. "She'll need several days of recovery, but there should be no complications. We'll monitor her closely and adjust her medication as needed." Yamamoto's recovery became a daily lesson in American medical abundance for the Japanese observers. Pain medication administered on schedule rather than rationed for extreme cases. Clean bandages changed daily rather than reused until they disintegrated. Nursing care that included regular vital sign monitoring, wound inspection, and patient comfort measures that seemed luxurious compared to the austere medical care they had provided in combat zones. The ship's pharmacy, which the Japanese women glimpsed during Yamamoto's treatment, contained medications that were legendary in Japanese military medicine. Penicillin, the miracle antibiotic that had been developed by the Allies but remained unavailable to Japanese forces except in captured samples. Morphine in quantities that exceeded what entire Japanese field hospitals possessed. Sulfa drugs, vitamins, and surgical supplies stocked in such abundance that routine waste exceeded what most Japanese medical units received in monthly allocations. Pharmacists mate first-class Chun, whose Japanese fluency made him the primary liaison with the prisoners, began informal educational conversations that revealed the scope of American medical logistics. The USS Sanctuary carried medical supplies sufficient to treat 750 patients simultaneously for extended periods. The ship's pharmacy was restocked monthly by supply vessels that carried more medical equipment than the entire Japanese medical service possessed in the Philippines. "How do you afford such medicine?" Nurse Tanaka asked during one of these conversations, her scientific curiosity overcoming her initial fear. "These drugs must cost fortunes." Chin's answer revealed industrial capacity that challenged fundamental assumptions about American military priorities. The Navy places orders for these medications in lots of millions of units. Mass production brings the unit cost down. We have pharmaceutical companies that produce nothing but military medical supplies. Penicillin alone is manufactured in dozens of facilities across the United States. The concept of industrial-scale pharmaceutical production dedicated to military medicine seemed fantastic to women who had served in medical units where individual ampoules of pain medication were cataloged and accounted for like precious metals. The casual mention of millions of units of advanced medications suggested resource allocation that contradicted everything they had been taught about American military weaknesses. Dr. Mitchell's approach to prisoner medical care reflected American military medicine's systematic philosophy. Each Japanese woman received individual treatment plans based on comprehensive medical assessment rather than generic care based on prisoner status. Those requiring additional nutrition received supplemented diets. Chronic conditions were treated with appropriate medications. Preventive care included vaccinations and health education designed to maintain long-term well-being. "We treat medical conditions, not nationalities," Dr. Mitchell explained when Tanaka questioned why enemies were receiving such thorough care. "Disease doesn't recognize political boundaries. A sick prisoner is still a human being requiring medical attention." This philosophy represented a fundamental difference from Japanese military medical doctrine, which prioritized treatment based on military utility and social hierarchy. American military medicine, constrained by Geneva Convention requirements and supported by abundant resources, treated all patients according to medical need rather than political or military considerations. The psychological impact of sustained high-quality medical care began manifesting within days. Japanese women who had expected brutality and neglect instead encountered systematic attention to their health and well-being. The cognitive dissonance between propaganda and reality created what American medical staff recognized as a form of cultural shock requiring careful management. Dr. Mitchell documented these psychological responses in her daily medical logs. The Japanese prisoners exhibit classic symptoms of cognitive dissonance when confronted with medical care that exceeds their expectations. Several have expressed confusion about American motivations for providing advanced medical treatment to enemies. This confusion appears to be generating fundamental questioning of their previous beliefs about American society and military capabilities. By December 25th, Christmas Day aboard the USS Sanctuary, the 23 Japanese women had been exposed to American military medicine for 1 week. Their medical conditions were improving under systematic treatment. Their understanding of American military capabilities was undergoing fundamental revision. Most importantly, their expectations about treatment as prisoners had been completely overturned by the reality of receiving medical care that exceeded what they had known as military medical personnel in the Japanese system. The transformation was subtle but profound. Women who had expected torture were receiving healing. Soldiers who had been taught that enemies were subhuman monsters were being treated by medical professionals who demonstrated competence and compassion. The foundation for a complete reevaluation of American society, industrial capacity, and military philosophy was being established through the simple provision of competent medical care to prisoners who had never expected to receive it. January 8, 1945. Angel Island Detention Center, San Francisco Bay. The 23 Japanese women arrived at the immigration station turned prisoner facility on a gray morning that obscured the San Francisco skyline in winter fog. They had been transferred from USS Sanctuary after medical clearance, traveling aboard a hospital ship that docked at the same pier where thousands of Asian immigrants had first encountered America decades earlier. What they found at Angel Island would complete their introduction to American medical capabilities operating at full industrial scale. The base hospital, constructed in just 90 days using prefabricated components shipped from mainland factories, represented American military engineering applied to medical infrastructure. The facility contained 150 beds arranged in wards designed for optimal patient care and medical staff efficiency. Every detail reflected systematic thinking about hospital design that optimized both medical outcomes and operational efficiency. Nurse Lieutenant Michiko Tanaka walked through the admissions process with growing amazement at the systematic thoroughness of American prisoner processing. Each woman received individual medical files that would follow them throughout their captivity. Comprehensive health assessments that included not just immediate medical needs, but long-term health monitoring. Assignment to medical care programs based on individual conditions rather than generic prisoner treatment protocols. The medical examination conducted by Army Medical Corps personnel introduced the Japanese women to military medicine operating under peacetime standards of care. Dr. Major Margaret O'Sullivan, the facility's chief medical officer, conducted examinations that exceeded the thoroughness of anything the Japanese women had experienced as military medical personnel serving in the Pacific Theater. "I'm going to conduct a complete neurological examination," Dr. O'Sullivan explained through Staff Sergeant Tanaka Hiroshi, a Nisei interpreter whose family had been interned at Manzanar while he served in the Military Intelligence Service. This includes vision testing, hearing assessment, and cognitive function evaluation. Standard procedure for all long-term prisoners. The neurological examination revealed the cumulative effects of prolonged combat stress and nutritional deficiency among several of the women. Auxiliary nurse Hanako Sato showed symptoms of peripheral neuropathy consistent with vitamin B complex deficiency. Nurse Keiko Yamamoto displayed fine motor tremors, suggesting chronic malnutrition effects on nervous system function. These conditions, accepted as inevitable consequences of wartime service in Japanese military medicine, were treated as serious medical conditions requiring systematic intervention. Dr. O'Sullivan's treatment approach challenged fundamental assumptions about medical resource allocation in military settings. Each woman received individualized treatment plans that addressed both immediate health needs and long-term recovery from the effects of prolonged military service under austere conditions. The medical resources allocated to achieve these treatment goals exceeded what entire Japanese military medical units had possessed in the Pacific Theater. Sato's peripheral neuropathy treatment included high-dose vitamin B complex injections, physical therapy to maintain muscle function, and occupational therapy to preserve fine motor skills. The medications alone cost more than a Japanese military physician's monthly salary. The therapeutic time invested by American medical personnel exceeded what most Japanese wounded soldiers had received during their entire hospitalization. "Why do you spend so much on enemies?" Sato asked Dr. O'Sullivan during one of her therapy sessions, her improving English allowing direct communication without interpreters. Dr. O'Sullivan's answer reflected American medical philosophy shaped by abundant resources and systematic approach to healthcare delivery. Medical care isn't something we ration based on nationality. You're a human being with a treatable medical condition. We have the knowledge and resources to help you recover. Why wouldn't we use them? The casual assumption that medical resources should be allocated based on medical need rather than political considerations represented a fundamental philosophical difference that the Japanese women struggled to comprehend. In their experience, medical care was rationed based on military utility, social hierarchy, and resource scarcity. The idea that enemies would receive optimal medical treatment simply because treatment was available challenged basic assumptions about human nature and social organization. The facility's dental clinic provided the most dramatic contrast with Japanese military medical priorities. Dental care in the imperial military was limited to emergency extractions and basic pain relief. Preventive dental care was considered a luxury incompatible with military austerity. At Angel Island, comprehensive dental examinations and treatment were provided to all prisoners as standard medical care. Lieutenant Colonel David Chun, the facility's chief dental officer, conducted examinations that revealed widespread dental problems among the Japanese women. Malnutrition, poor dental hygiene due to limited supplies, and combat stress had created dental conditions that would have been ignored or treated with extractions in Japanese military medicine. Chen's treatment approach reflected American dental medicine's emphasis on preservation and restoration rather than simple extraction. Auxiliary nurse Yuki Nakamura, who had lost 3 teeth to nutritional deficiencies during her service in the Philippines, received a partial bridge crafted by American dental technicians. The prosthetic was manufactured using precious metals and dental materials that exceeded the value of equipment available to entire Japanese military dental units. The precision of fit and attention to aesthetic appearance seemed incomprehensible for prisoner medical care. This is better than what wealthy civilians could obtain in pre-war Japan, Nakamura observed to her fellow prisoners, running her tongue over teeth that felt natural and functional. They gave an enemy dental work that costs more than most Japanese families earn in a year. The psychological impact of receiving high-quality dental care extended beyond simple medical improvement. Nakamura could eat comfortably for the first time in months, speak clearly without self-consciousness about missing teeth, and smile without embarrassment. The restoration of personal dignity through medical care created emotional responses that challenged her understanding of American motivations and character. Dr. Chin's approach to prisoner dental care reflected systematic thinking about long-term health maintenance that was foreign to Japanese military medical philosophy. Each woman received not just treatment for existing problems, but preventive care designed to maintain dental health throughout their captivity and beyond. Dental education about proper hygiene techniques. Access to dental supplies including toothbrushes and toothpaste of quality superior to what most Japanese civilians possessed. We're not just fixing immediate problems, Dr. Chun explained to the interpreters during a group dental health education session. These women may be prisoners for months or years. Their long-term health is our responsibility while they're in American custody. Poor dental health leads to nutritional problems, systemic infections, and psychological stress. Preventing these problems is more efficient than treating them after they develop. The systematic approach to preventive healthcare represented American military medicine's industrial efficiency applied to prisoner care. Rather than waiting for medical problems to develop and require expensive emergency treatment, American medical personnel invested in preventive care that maintained health and prevented more serious conditions. This philosophy required abundant resources and long-term thinking that seemed impossible given the resource constraints under which Japanese military medicine operated. The facility's mental health services provided another revelation about American medical capabilities and philosophy. Military psychiatry was virtually unknown in Japanese military medicine, where psychological problems were treated as character defects requiring discipline rather than medical conditions requiring treatment. At Angel Island, psychological assessment and treatment were standard components of prisoner medical care. Captain Robert Yamada, a psychiatrist whose parents had immigrated from Hiroshima before World War I, conducted psychological evaluations that revealed the cumulative stress effects of prolonged combat exposure among the Japanese women. Post-traumatic stress symptoms, depression, and anxiety disorders were identified and treated as medical conditions rather than character failures. Combat stress is a normal response to abnormal conditions, Captain Yamada explained during group therapy sessions that were entirely new experiences for the Japanese women. Your psychological symptoms are as real and treatable as physical injuries. We have medications and therapeutic techniques that can help you recover from these experiences. The concept of mental health treatment provided to prisoners challenged fundamental assumptions about human psychology and social responsibility. Japanese military culture treated psychological distress as weakness requiring harsh discipline to overcome. American military medicine treated the same conditions as medical problems requiring professional intervention and systematic treatment. Nurse Tanaka's sessions with Captain Yamada revealed psychological trauma from witnessing repeated deaths of patients who could have been saved with adequate medical resources. The guilt of practicing triage medicine, where treatment decisions were based on resource scarcity rather than medical need, had created persistent anxiety and depression. Yamada's treatment included both medication and talk therapy designed to process traumatic experiences and develop healthy coping mechanisms. "You did the best you could with the resources available," Yamada told Tanaka during one therapeutic session. Medical personnel shouldn't have to make life-and-death decisions based on supply shortages. "The trauma you experienced was caused by impossible situations, not personal failures." This therapeutic approach, which separated individual responsibility from systematic failures, provided psychological relief that Japanese military culture had made impossible. The validation of emotional responses as normal reactions to abnormal stress rather than personal weakness created space for psychological healing that military discipline had prevented. By February 1945, the cumulative impact of comprehensive medical care was producing visible changes among the Japanese women prisoners. Physical health improvements from adequate nutrition and medical treatment. Dental restoration that improved both function and appearance. Psychological healing from professional mental health intervention. Most significantly, fundamental revision of beliefs about American society's values and capabilities. The women had expected brutality and received healing. They had anticipated neglect and encountered systematic attention to their well-being. They had been taught that Americans were barbarous and discovered medical professionals whose competence and compassion exceeded what they had known in their own military service. The foundation for complete ideological transformation was being established through the simple provision of medical care that demonstrated American values through action rather than propaganda. March 1945, Angel Island Detention Center. The psychological transformation of the 23 Japanese women had reached a critical threshold after 2 months of sustained exposure to American military medicine operating at full capacity. What began as simple medical treatment had evolved into a comprehensive education about American industrial capabilities, social values, and fundamental assumptions about human dignity that challenged everything they had been taught about their enemies. The catalyst for the most profound ideological shift came through witnessing American military nurses at work. These women held rank equivalent to officers, made critical medical decisions, and commanded respect from male colleagues in ways that were impossible within the rigid hierarchy of Japanese military culture. Lieutenant Nurse Margaret O'Brien, the base's head nurse, represented authority structures that contradicted basic assumptions about gender roles and military organization. Nurse Lieutenant Michiko Tanaka observed O'Brien's daily routine with fascination that bordered on disbelief. The American nurse conducted staff meetings where male medical personnel deferred to her expertise. She made decisions about patient care that were implemented without question by doctors and orderlies. Most remarkably, her authority derived from medical competence and administrative skill rather than family connections or political influence. In American military medicine, the best ideas are implemented regardless of who suggests them, O'Brien explained during one of the informal educational sessions that had developed as part of prisoner integration. Medical effectiveness requires using all available knowledge and talent. Gender, social background, and personal connections are irrelevant compared to competence and results. This meritocratic approach to medical administration represented social organization that the Japanese women had never witnessed. In imperial military medicine, authority flowed strictly through hierarchical channels based on rank, gender, and social position. Medical decisions were made by senior male physicians regardless of their actual expertise in specific conditions. The efficiency gains from utilizing all available talent seemed impossible given their understanding of proper social order. The most dramatic demonstration of American medical capabilities came when auxiliary nurse Sachiko Ito developed symptoms of tuberculosis, a disease that had reached epidemic proportions in Japanese military units due to malnutrition, overcrowding, and inadequate medical resources. In Japanese military medicine, tuberculosis was essentially a death sentence for personnel serving in the Pacific Theater. Treatment options were limited to isolation and palliative care until the patient died or recovered through natural immunity. Dr. Major Margaret O'Sullivan's response to Ito's diagnosis challenged every assumption about tuberculosis treatment that the Japanese women possessed. immediate chest X-rays using equipment that produced clear images of lung damage, laboratory tests that identified the specific strain of tuberculosis bacteria. Most importantly, treatment with streptomycin, an antibiotic that had been developed specifically for tuberculosis treatment but remained unknown to Japanese military medicine. Tuberculosis is a serious condition, but it's treatable with the right medications, Dr. O'Sullivan explained to the worried group of Japanese women. Streptomycin has shown excellent results in clinical trials. With proper treatment, most patients make complete recoveries. The casual confidence with which American medical personnel approached tuberculosis treatment seemed impossible to women who had watched colleagues die from the disease throughout their military service. The availability of advanced antibiotics for prisoner treatment contradicted everything they understood about resource allocation during wartime. Most significantly, the willingness to invest expensive medications in enemy recovery suggested social values that challenged fundamental assumptions about human worth and medical priorities. Ito's treatment regimen included daily injections of streptomycin, supplemental nutrition designed to support immune system function, and careful monitoring for side effects and treatment progress. The medical resources allocated to her care exceeded what entire Japanese military medical units possessed for tuberculosis treatment. Within weeks, her symptoms began improving in ways that seemed miraculous to observers who understood tuberculosis as an inevitably fatal condition. "They saved my life with medicine we didn't know existed," Ito wrote in letters home that were censored but approved for mailing. American doctors treated tuberculosis like any other infection. They have drugs that cure diseases we thought were death sentences. The medicine they gave to one enemy prisoner cost more than our entire field hospital's annual drug budget. The psychological impact of witnessing effective tuberculosis treatment extended beyond simple amazement at medical capabilities. Ito's recovery demonstrated American pharmaceutical development and production capacity that suggested industrial capabilities far beyond what Japanese propaganda had claimed. The casual availability of advanced medications for prisoner treatment indicated resource abundance that challenged basic assumptions about American military weakness. Dr. O'Sullivan used Ito's case as an educational opportunity to explain American pharmaceutical research and development to the Japanese women whose medical backgrounds allowed them to understand the significance of what they were witnessing. The development of streptomycin had required coordinated research by multiple universities, pharmaceutical companies, and government agencies. Clinical trials had involved thousands of patients across dozens of medical centers. Production required industrial facilities specifically constructed for antibiotic manufacturing. Streptomycin development cost approximately $12 million and required 3 years of intensive research, Dr. O'Sullivan explained during one of the educational sessions that had become regular features of prisoner routine. "We have similar programs developing medications for malaria, surgical infections, and combat injuries." American pharmaceutical companies are producing millions of units of advanced medications specifically for military use. The scope of American pharmaceutical development challenged fundamental assumptions about industrial priorities and resource allocation during wartime. Japanese military medicine operated under the assumption that advanced medications were luxury items incompatible with wartime austerity. American military medicine treated pharmaceutical development as essential infrastructure requiring massive investment and systematic organization. The educational programs that had emerged at Angel Island provided systematic exposure to American scientific and medical literature that revealed the scope of ongoing research and development. Medical journals describing surgical techniques that were years ahead of Japanese military medicine. Research papers documenting pharmaceutical developments that were revolutionizing treatment of previously incurable conditions. Most importantly, evidence of systematic cooperation between civilian and military medical establishments that maximized available expertise and resources. Nurse Tanaka's access to American medical journals through the prison library created cognitive shock that challenged her understanding of scientific progress and international cooperation. American medical research included contributions from refugee scientists who had fled Nazi Germany and occupied territories. Jewish physicians whose families had been murdered by Axis forces were developing medications that saved American soldiers' lives and were being provided to act as prisoners. They show us their most advanced research, Tanaka wrote in her hidden diary, using paper obtained from the prison library. Medical journals with discoveries that are years ahead of anything we learned in medical school. They let enemies read about their newest surgical techniques, their pharmaceutical developments, their treatment protocols. This openness from victors to defeated enemies reveals confidence that we never understood. The sharing of medical knowledge with prisoners represented American values that were incomprehensible to minds shaped by military secrecy and technological hoarding. Japanese military medicine operated under assumptions that medical knowledge was strategic information requiring protection from enemies. American medical personnel casually shared advanced techniques and research findings with prisoners who had recently been treating wounded soldiers fighting against American forces. The most profound psychological transformation occurred through witnessing American medical personnel's approach to professional ethics and patient care. Dr. O'Sullivan's treatment of a severely injured American soldier in the bed adjacent to Ito's tuberculosis treatment area demonstrated medical priorities that challenged fundamental assumptions about loyalty and resource allocation during wartime. The American soldier, Corporal James Mitchell, had suffered multiple wounds during fighting on Iwo Jima, including traumatic amputation of his right leg, severe burns, and internal injuries that required multiple surgeries. His treatment consumed enormous medical resources, including repeated operations, experimental burn treatments, and round-the-clock nursing care. Yet Dr. O'Sullivan allocated equal attention and medical resources to Ito's tuberculosis treatment, an enemy prisoner whose recovery provided no military advantage to American forces. Medical need determines treatment priority, Dr. O'Sullivan explained when Tanaka questioned why enemy prisoners received the same quality of care as wounded American soldiers. A patient is a patient regardless of nationality. Disease and injury don't recognize political boundaries. Our job is healing, not making political judgments about who deserves treatment. This professional ethic represented medical philosophy that separated healing from political considerations in ways that Japanese military medicine had made impossible. The systematic provision of optimal medical care to all patients regardless of military or political status demonstrated social values that prioritized human welfare over narrow military advantage. The educational impact of observing American medical ethics extended beyond simple amazement at resource abundance. The Japanese women witnessed medical professionals whose competence and dedication exceeded what they had known in their own military service, yet who treated enemies with the same professional attention given to their own wounded soldiers. This consistency between stated values and actual behavior created credibility that propaganda could never achieve. By April 1945, the cumulative exposure to American military medicine had produced complete ideological transformation among the Japanese women prisoners. They had witnessed industrial capacity that made Japanese military production seem primitive. They had received medical care that exceeded what Japanese civilians could access in peacetime. Most importantly, they had observed social values that demonstrated strength through compassion rather than brutality through conquest. When news of President Roosevelt's death reached Angel Island on April 12, the Japanese women's response revealed the depth of their psychological transformation. Rather than celebration at the death of their former enemy, several expressed genuine sadness at the loss of a leader who had created the systems that treated prisoners with dignity and provided healing to enemies. President Roosevelt created the America that saved our lives, Nurse Tanaka wrote in her diary. His death is mourned by those he called enemies because we learned that his America was stronger through kindness than our empire was through cruelty. The preparation for eventual repatriation began in May 1945 as the Pacific War neared its conclusion. American authorities provided vocational training, language education, and cultural orientation designed to help the women readjust to post-war Japan. Most significantly, they were trained in American medical techniques and given access to medical literature that would allow them to introduce advanced treatments to Japanese civilian medicine. Dr. O'Sullivan's farewell address to the repatriating prisoners captured the essence of what the women had experienced. You came to us as enemies and leave as colleagues in the healing profession. You have witnessed American medicine at wartime peak capacity. you understand that our strength comes not from weapons, but from our commitment to human welfare, including the welfare of our enemies. Take this knowledge home and help build a Japan that heals rather than conquers. The 23 Japanese women who returned to their homeland in late 1945 carried more than memories of their captivity. They brought knowledge of medical techniques that would revolutionize Japanese healthcare, understanding of social organization that would influence post-war democratic development, and most importantly, evidence that former enemies could become partners in human progress. Their transformation from imperial warriors to witnesses of democratic values represented one of history's most successful examples of ideological conversion through demonstration rather than coercion. They had expected death and received healing. They had anticipated brutality and encountered compassion. They had been taught that Americans were monsters and discovered medical professionals whose dedication to human welfare exceeded anything in their previous experience. The legacy of their experience would influence Japanese medical development, women's roles in post-war society, and Japan's relationship with the United States for decades to follow. They had seen America's true strength and understood that a nation secure enough to heal its enemies possessed power that conquest could never achieve.